Factors influencing the counseling process. Client factors: personality, motivation, readiness to change, cultural background, and mental health statuses. Counselor factors: skills, experience, empathy, communication style, and cultural competence. Environmental factors: setting, privacy, time constraints, and available resources. Therapeutic relationship: trust, rapport, and mutual respect between counselor and client. External influences: social support, family dynamics, and societal attitudes towards counseling. Initial interview in counseling. Purpose: establish rapport, gather client information, and set counseling goals. Key components: clients presenting problem, personal history, and expectations. Techniques: active listening, open-ended questions, and empathy. Importance: builds trust and lays foundation for therapeutic relationship. Challenges: client resistance, confidentiality concerns, and time constraints. Types of initial interview. Client versus counselor initiated. Client-initiated interview. Client takes the lead in sharing concerns and setting the agenda. Counselor-initiated interview. Counselor guides the session with structured questions and focus. Purpose varies. Client-initiated, often more open-ended. Counselor-initiated, more goal-directed. Both types aim to build rapport and gather essential information. Information-oriented first interview. Focuses on gathering detailed client information and history. Uses structured and open-ended questions to understand presenting problems. Helps in diagnosis, assessment, and planning treatment goals. Emphasizes accuracy and completeness of client data. Relationship-oriented first interview. Focuses on building trust and rapport between client and counselor. Uses empathy, active listening, and supportive communication. Aims to create a safe environment for client self-disclosure. Foundation for a strong therapeutic alliance and ongoing counseling. Conducting the initial interview. Empathy. Empathy involves understanding and sharing the feelings of the client. Helps build trust and rapport, making clients feel heard and valued. Encourages open communication and self-disclosure. Requires active listening and genuine concern without judgment. Conducting the initial interview. Verbal behavior. Use clear, supportive, and non-judgmental language. Ask open-ended questions to encourage detailed responses. Reflect and paraphrase client statements to show understanding. Avoid interrupting and allow clients to express themselves fully. Conducting the initial interview. Nonverbal behavior. Maintain appropriate eye contact to show attentiveness. Use facial expressions that convey warmth and understanding. Adopt an open posture to appear approachable and engaged. Be mindful of tone, pace, and volume of speech to match client comfort. Working through the counseling relationship. Key techniques. Changing perceptions. helping clients see situations from new perspectives to foster growth. Leading, guiding clients gently towards insight and solutions without dominating the conversation. Multi-focused responding, addressing multiple client issues simultaneously to provide comprehensive support. Accurate empathy, deeply understanding and reflecting the client's feelings and experiences authentically. Self-disclosure, appropriately sharing counselors' experiences to build trust and rapport. Immediacy, addressing the here and now dynamics in the counseling relationship to enhance awareness. Humor, using humor sensitively to ease tension and build connection. Working through the counseling relationship. Advanced strategies. Confrontation, gently challenging discrepancies or avoidance to promote client awareness. Contracting, establishing clear agreements on goals, roles, and boundaries to structure the counseling process. Rehearsal, practicing new behaviors or responses within the safe counseling environment. Dealing with resistance and reluctance, recognizing and addressing client hesitations to maintain progress. Transference, understanding clients' unconscious redirection of feelings onto the counselor. Countertransference, counselors' emotional reactions to the client, requiring self-awareness and management. Termination of the counseling relationship. Definition: the planned conclusion of the counseling process. Importance: ensures closure and consolidates client progress. Timing: initiated when goals are met or client is ready to end. Preparation: discuss termination early and revisit throughout counseling. Emotional responses: clients may feel relief, anxiety, sadness, or ambivalence. Counselor's role: support client through feelings and reinforce gains. Review progresses. Summarize achievements and strategies learned. Future planning. Discuss maintenance of progress and potential follow-up. Handling reluctance. Address client resistance to ending counseling. Ethical considerations. Ensure termination is in the client's best interest and provide referrals if needed. Strategies for effective termination. Gradual processes. Slowly reduce session frequency to ease transition. Reinforce client strengths. Highlight clients' growth and coping skills. Encourage autonomy. Empower client to use skills independently. Provide resources. Offer referrals, support groups, or reading materials. Plan for setbacks. Discuss potential challenges and coping strategies. Celebrate successes. Acknowledge clients' efforts and progress. Follow-up options. Arrange check-in sessions if appropriate. Documentation. Complete necessary records and evaluations. Need for termination in counseling. Closure of counseling process when goals are met. Prevents dependency on counselor. Encourages client autonomy and self-reliance. Allows client to apply learned skills independently. Timing of termination. Based on achievement of therapeutic goals, client readiness and emotional stability. Mutual agreement between counselor and client. Consideration of external factors. For example, life changes. Issues of termination. Individual sessions. Ending sessions gradually to ease transition. Review progress and reinforce strengths. Discuss coping strategies for setbacks. Provide resources and referrals if needed. Issues of termination. Counseling relationship. Acknowledge the emotional impact of ending. Celebrate clients' growth and achievements. Plan for follow-up or booster sessions if appropriate. Complete documentation and evaluations. Resistance to termination. Client may feel anxious or abandoned. Fear of losing support or relapse concerns. Counselor to address feelings openly. Use termination as a therapeutic opportunity.
Thank you. Please subscribe for more psychology content and concepts. Thank you. Please subscribe for more psychology content and concepts. Thank you. Please subscribe for more psychology content and concepts.